This training module covers infection control procedures. It is our policy to ensure that the facility staff work to reduce and prevent infection, disease, and contamination, and to maintain a clean and sanitary environment. Each staff member shall complete 1 hour of training that covers infection control practices, universal precautions, and facility sanitation procedures. When assisting residents with self-administration of medications, clean and sanitize the medication counter before starting the med pass. Wash your hands prior to the medication pass. And sanitize your hands between each resident to avoid contaminating medications in any way. If there is contamination of the medication counter surface, sanitize the medication counter and your hands before assisting the next resident. When in doubt, sanitize. When you are assisting residents with blood checks, for those residents who have diabetes, each resident shall have their own machine with their name clearly labeled on the machine. You will make the machine available to the resident and make available an approved sharps container for used lancets or other items that were used during the blood test. Each staff member shall take steps to ensure that appropriate infection control measures are used when providing direct care to each resident. When you are assisting a resident with personal care, which includes shaving or grooming, you will utilize 1 disposable shaver per resident, and you will use hand gloves. Be sure to replace those hand gloves with each resident and keep the area sanitized while working with the resident. When you assist residents with laundry services or clothing transport to the laundry room, you will ensure that soiled clothing are transported in a laundry basket, if available, or in a plastic bag. This will ensure clothing items remain separate prior to cleaning. You will also use latex gloves when handling the laundry. When you are changing bed linens, you will utilize latex gloves and place the dirty sheets into bags to be transported to the linen company for cleaning at their plant. The staff shall not handle the sheets using hands only, and you will utilize the necessary precautions by wearing gloves. When you are assisting residents with food, the staff members shall have completed the food safety training and shall ensure that their hands are washed before assisting with serving food. All food shall be handled by the person assigned to the food service area, and that person shall be responsible for washing hands whenever hands come in contact with a potential source of contamination or other human contact. Facility staff shall be required to document changes in resident conditions and to link these observations to the assigned case management staff for appropriate linkage with professional medical care and evaluation of symptoms to rule out infectious diseases. When you are called on to assist with cleaning up of a loss of body fluids, you must take appropriate universal precautions, which includes the use of latex gloves. This will ensure that you avoid coming in contact with the body fluids. The items that are soiled or require cleaning shall be placed in a plastic bag and transported to the facility's laundry room to be cleaned. The floors and surface areas that came in contact with the body fluid shall be cleaned to disinfect the area to ensure it does not pose a risk to other residents. The facility has a pest control contract in place to control the presence of pests in the living areas. When there is a problem identified, the staff are to contact the facility manager to report the problem so that the pest control company can be called to address the issue. The facility manager shall conduct regular inspections of the buildings to ensure that sanitary requirements are met and that wastewater systems meet the requirements for safe operating standards. It is important to know about infection control precautions necessary for COVID-19. Number 1, limit how germs can enter the facility. This is why we have canceled elective outings and we are using telemedicine when possible. We have limited the points of entry and we are restricting visitors and screening residents for respiratory symptoms. Please encourage residents to use respiratory hygiene. This means they will cover their cough or sneeze and they will dispose of tissues used. Number 2, we will isolate symptomatic patients as soon as possible. We will set up separate, well-ventilated triage areas and place residents with confirmed or suspected COVID-19 in those private rooms. Those doors should remain closed. Third, it's important to protect you. So, we emphasize hand hygiene. We will be installing barriers to limit contact with those residents, and we will limit the number of staff providing their care. Screening is very important as we deal with COVID-19. You are required to screen everyone who approaches the facility. This includes staff, law enforcement, EMS, any state or county inspectors. It includes vendors, whether they be with pharmacy or food delivery. This includes everyone. The screening process includes checking their temperature. If you get an increased temperature, call the administrator. You must screen for cough, shortness of breath, and international travel. And because there are so many cases in South Florida, please screen for travel in South Florida. Every day, we must check and document resident temperatures. These temperatures should be recorded in PCC. Report any temperatures over 99.6 to the administrator. Isolate that resident from others. And then you should wash your hands and put on a surgical mask. All staff are now required to wear a mask at all times. And when you are providing direct care to residents, you are required to also wear gloves. It is important for you to wash your hands before putting on gloves. When you are wearing a mask, it is important that you not touch the mask while you are wearing it. Clean hands if you do touch the mask. And be sure to learn how to properly put on, remove, and dispose of the mask. After you dispose of the mask, please clean your hands. Cleaning and disinfecting is especially important as we deal with COVID-19. You will want to clean and disinfect all frequently touched surfaces, and you will do this daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If the surfaces are dirty, clean them using detergent or soap and water and then disinfect them. You must clean first and then disinfect. There are important safety precautions to take when you're cleaning and you've had someone with COVID-19. First, close off areas used by the ill person and wait as long as practical before beginning cleaning and disinfection. This will help minimize potential for exposure to respiratory droplets. Second, open outside doors and windows to increase air circulation in the area. If possible, wait up to 24 hours before beginning cleaning and disinfection. So, our cleaning and disinfecting priorities include focus on cleaning and disinfecting common areas where staff and others providing services may come into contact with the ill person. We will reduce cleaning and disinfection of bedrooms and bathrooms used by ill persons to as needed. In areas where ill persons have visited or used, we will continue routine cleaning and disinfection. So, when we are engaged in cleaning and dealing with COVID-19, we will be careful to wear disposable gloves when we are cleaning and disinfecting. Gloves should be discarded after each cleaning. And immediately clean your hands after you take your gloves off. If surfaces are dirty, they should be cleaned prior to disinfection. So we have two steps. First, we clean. Second, we disinfect. To fight the coronavirus, it is important to use the right disinfectant. Diluted household bleach solutions, alcohol solutions with at least 70% alcohol, and most common household disinfectants should be effective against COVID-19. Diluted household bleach solutions should only be used if appropriate for the surface. If you have a question, please ask. Remember, never mix household bleach with ammonia or any other cleanser, as this may be harmful to your health. Check to ensure the product is not past its expiration date. The bleach will be effective against coronaviruses only if it's not expired. So to prepare a bleach solution, you will mix 1/3 cup bleach for each gallon of water. For soft or porous surfaces, such as carpeted floors, rugs, or drapes, you will remove visible contamination if present, and then spray with Lysol disinfectant. After cleaning, we will launder the items as appropriate. If possible, we will use the warmest appropriate water setting for the items and dry the items completely. The COVID-19 laundry protocol requires that we wear disposable gloves when handling dirty laundry from an ill person, and then discard those gloves after each use. Wash your hands immediately after your gloves are removed. If possible, do not shake dirty laundry. This will minimize the possibility of dispersing virus through the air. Again, use the warmest appropriate water setting for the items and dry the items completely. Then, if we're cleaning the laundry from someone who has COVID-19, we will need to clean and disinfect the hamper. If possible, consider placing a bag liner that is either disposable or can be laundered. Other considerations. The ill person should eat in their room if possible. Non-disposable food service items should be handled with gloves and washed with hot water in the dishwasher. Again, clean your hands after handling used food service items. If possible, dedicate a lined trash can for the ill person. Use gloves when removing garbage bags. Wash your hands after handling or disposing of trash. So let's review. First of all, clean your hands often. Wash your hands with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If you hum happy birthday to yourself, this will tell you when you have reached 20 seconds. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Know the symptoms of COVID-19. These symptoms may appear 2 to 14 days after exposure. The symptoms include fever, cough, and shortness of breath. Know how COVID-19 spreads. Since there is currently no vaccine to prevent coronavirus, the best way to prevent illness is to avoid being exposed to this virus. The virus is thought to spread mainly from person to person, either between people who are in close contact with one another, within 6 feet, or through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Avoid close contact with people who are sick. Put distance between yourself and other people if COVID-19 is spreading in your community. This is especially important for people who are at higher risk of getting very sick. If you are sick, call the facility administrator. Give as much notice as possible and stay home. Isolate yourself so that others don't get sick. It is possible that we will need to care for a COVID-19 positive resident. Staff who care for that COVID positive resident must wear the following personal protective equipment: gown, shoe covers, gloves, face mask, and eye shield. Refer to posted guides showing how to properly put on and take off PPE. Failure to follow the correct protocols will spread harmful germs. As you approach each workday, please remember that you are writing history. How you respond to COVID-19 will either help or hurt the virus spread. Please be deliberate in following the necessary infection control precautions. Please wash your hands, screen everyone who comes in the door, and help monitor resident temperatures. Thank you for all that you do to ensure the safety and well-being of all of our residents. We truly appreciate you. Remember, we're all in this together, and we will win this war, one day at a time. Thank you, and God bless.